Good morning, everyone, and happy Monday. Welcome again to the conversation we're having about social work power. And today we are going to go back into the article that we started reading last time in terms of the role of social workers in transforming mental health and continue the conversation. And so all of this is about an exploration of who it is that we are as social workers, what our role is, being able to really begin to identify with those things. We also just started our Social Work Power Certificate course, which runs on Fridays from 3:30 to 5. And our first session was amazing. A lot of really dynamic social workers coming and making a contribution to the conversation, what it means for them to be social workers, what it means to have power, and what that power looks like, feels like, and what it is to exercise it, not just in the context of clients, but in the context of self and who we are, what our strengths are, and what we bring to the table on a regular basis. So it was amazing conversation, and I look forward to this Friday when we continue that in our second session of the certificate course. You could come to one, you could come to all of them. Just come and have a seat at the table in what we're up to and how we're going to transform mental health. So I'm gonna share the article that we are referring to in this conversation, which is here, and this is the role of social workers in transforming mental health. And we've been reading through this. Last time we read about the limited access, and so we're going to continue right here where it says, furthermore. Furthermore, measuring outcomes in mental health can be intricate, unlike some medical conditions where physical parameters can be monitored. Progress in mental health often relies on subjective self-reporting, making it difficult to gauge the effectiveness of interventions accurately. Addressing the challenges within the field of mental health requires a comprehensive approach that extends beyond scientific and medical advancements. It encompasses societal attitudes, policies, and accessibility to ensure that the benefits of mental health research effectively apply to those who require assistance. This holistic perspective recognizes that the success of mental health initiatives is intertwined with various factors that shape individuals' experiences and opportunities for recovery. This is where the crucial role of social workers becomes evident. Social workers possess a unique set of skills and expertise that allow them to bridge the gap between individuals and the resources they need. With their deep understanding of social systems, human behavior, and community dynamics, social workers are well equipped to address the complex interplay of factors that influence mental health outcomes. And so I'm going to stop there, and I'll include the link I'll include the link below to that article so that you can continue to review it for yourself as well. And I think it really speaks to, if we look at some of the roots of social work, and having your boots on the ground and being where our clients are and being able to see what it is that their experiences actually are in their communities. And then whether or not that's then reflected in the kind of interventions and resources that are available. And are those interventions and resources the same ones that I would want to take part in? And so, there are things that I have the opportunity for, that I have the privilege to have access to, that many of my clients don't. And for the services that my clients do have access to, would I go to those services? Are they things that I would want my child to go get services from? And if that's not the case, then there is a disconnect between how it is that we understand, how it is that organizations, policies, research translates into, and evidence-based practices translate into, how it is that our clients receive services, where they receive services, whether or not those services are cookie cutter, or if they are more specific to the individual person and their individual needs. And we know that there are a lot of gaps in research, that in terms of how evidence-based practices are implemented, whether or not the research has been done with a similar population or not, whether or not the population the research was done on can be applied to the population that we might be serving. What might those gaps be? And because we do have this unique ability to really be in that space with our clients to understand what it is like, or at least to be in a place of truly listening to our clients in terms of what their experiences are like, what is their social context, how are they surviving or thriving or not in the given circumstances that they are. It allows us in a much more dynamic way to really be able to look at what it is that is being achieved in the process. And is it truly what our clients want to achieve, or are the goals that are being set up for our clients under these evidence-based practices more about what we want, where we are doing to our clients, versus what it is that they want, where they get to live a life that's fulfilling for them? So let me hear from you. I'd love to hear your thoughts about this. Please come back next Monday for an ongoing conversation. And then on Wednesday, we have another conversation that we're going to have all about transforming mental health. So have a wonderful, wonderful rest of your day. And we look forward to seeing you here again.